First aid is the initial assistance given to a casualty using the locally available materials and generally accepted principles before handing over to a more responsible person. And this is a very crucial skill for all of us. And today I'm here to help you learn some of these life-saving priorities. We'll start by looking at choking. What is choking? Choking is the partial or complete obstruction of the airway. Minor choking is partial obstruction, and major choking is complete obstruction. Recognition features. How will you know that a person is choking? Number one, the person may be coughing. There may be difficulty in breathing and difficulty in speaking. And the person, as the condition continues, the person may start grasp at the neck and start pointing at the mouth. And they may also have bulging of the eyes and constriction of the face vessels. How do you attend to a person who is choking? I'll demonstrate using my colleague, Mike. Welcome, Mike. Now, assuming Mike is choking. Now, Mike, pretend like you're choking. Now, assuming maybe he was taking a meal or maybe swallowed a sweet or any foreign object. The first thing you do is you find out whether the person is choking. You introduce yourself and find out, hello, Mike, I'm Steve, a first aider. May I help you? Are you choking? Cough, cough. So you encourage the person to cough. Encourage the person to cough. If it's a minor obstruction, the object will come out. If it's major obstruction, you have to go to the next step. So encourage coughing. Keep on coughing, cough. If it doesn't come out, you give up to 5 sharp back blows. And this is how you do it. You position yourself centrally behind the casualty, and you support the casualty at the abdomen. Between the 2 shoulder blades, using your heel, you give up to 5 sharp back blows. And this is how you do it. 1, 2, 3, keep on coughing 4, 5. Now up to 5 means if you give the first blow and the second one and the obstructor come out, you stop at that. You don't have to continue. But if it doesn't come out, you continue until the 5th blow. If it doesn't come out, you go to the other step, abdominal thrust. For abdominal thrust, you hold your fist using the other palm, and you place the fist between the casualty's navel and chest bone. This is how you do it. Then you give 5 abdominal thrust. 1, 2, 3, 4, 5. Then it will come out. Thank you, Mike. If it is an infant, the infant may not be able to communicate to you that she or he is choking. So what you do, you get hold of the infant mouth, you sit down, support the infant, make sure the mouth is below the chest, and then using your 2 fingers of all part of the heel, you give up to 5 back blows. If it doesn't come out, you support the head, turn the infant at the chest, using your 2 fingers, you give up to 5 chest thrusts. 1, 2, 3, 4, 5. If you see it coming, you remove it with 2 fingers, then you reassure the infant. And you can give, if you are the parent, you can circle the baby, and you have saved that life. Thank you very much. Nose bleeding is the rupturing of the nose vessels, and this can be caused by several issues. One, it can be caused by a direct blow. It can be caused by change in atmospheric pressure. Nose bleeding can be caused by high blood pressure. It can also be caused by nose picking and foreign objects, amongst other factors. Now, how do you manage nose bleeding? The first thing you do, you have to reassure the casualty. You reassure your casualty at the same time finding out what caused this nose bleeding. So I'll come and introduce myself. Hello, how are you? My name is Steve, a first aider. May I help you? What happened?
I was not the door.
Okay, sorry, I'll help you. Kindly lean forward and breathe using your mouth. And using your 2 fingers, you pinch the soft part of the nose. So encourage the casualty to pinch the soft part of the nose for 10 minutes. During this time, you reassure, encourage the casualty to comfort the casualty, and after 10 minutes, you help the casualty to release the nose and you wipe. Use a piece of clothing to wipe the nose. If the blood is still coming out, you help the casualty to pinch again for 10 minutes. After 10 minutes, you release and wipe using a piece of clothing. If it's still coming out, you pinch again for 10 minutes. So 10 minutes 3 times. After the third time, if it's still coming out, that is an emergency case, you call an ambulance immediately. Now, as you help the casualty, through pinching the nose, you'll save that life. Unfortunately, there are other people who tend either to help the casualty lay down or encourage the casualty to face up. That will not help stop bleeding. In any case, this blood will go out. It may find its way into the esophagus and induce vomiting. The blood again may find its way into the windpipe and cause secondary drowning. Also, the blood may form may stick somewhere at the back of the brain and may end up becoming a tumor. So always encourage the casualty to lean forward and pinch the nose, the soft part of the nose. Again, you may not need to use cold water. Some people use cold water. As a first aider, you don't need to do that. Just pinch the nose and you'll have saved that life. Now, if it is a severe case where even after helping the casualty is still bleeding, you have to call an ambulance or you take the casualty to the nearest hospital to save that life. Thank you very much. Today, I'm here to train you on how to manage external bleeding, specifically a wound. A wound can be caused by several factors. It can be due to a fall, it can be due to a trauma attack, it can be even due to any sort of an accident. And we'll start by looking at a wound around the palm. For example, let's say you are cooking, you're in the process of cutting a fruit or a cake, you end up cutting your palm. How do you manage bleeding? The first thing is you assess the situation, ensure you are safe as you attend to your colleague. You introduce yourself and you get the consent. Hello, how are you? My name is Steve, a first aider. May I help you? What happened?
I got cut.
Okay, sorry, I'll help you. Please apply pressure and elevate. So you apply pressure and elevate. If need be, you can try expose the wound. After applying pressure, and the reason why you elevate is to help reduce the level of bleeding. Then you use a wound dressing or a piece of clothing, and all this time keep reassuring the casualty. So using a wound dressing, you come and you place it directly on the wound. So please support your arm. I'll help you and take you to the nearest hospital. Or do you want me to call an ambulance?
Yeah.
You want me to call an ambulance? Okay, we'll get an ambulance for you and take you to the hospital, but you'll get well. So what happened?
I just got cut.
Okay, you get well. How are you feeling now? Where do you come from? From town. Okay, who do you live with?
I live with my parents.
With your parents. Do you need to contact your parent for this? Okay. So that's how you do it. You reassure the casualty and you avoid making the casualty feel bad. Avoid what's like, oh yeah, you'll be okay. This is serious. This is very serious. Avoid that. Just reassure the casualty and make sure the casualty feels comfortable. And that's how you manage a wound. That's how you manage a wound. And then after that, you call an ambulance. You can also take the casualty to the hospital. You can support this arm with a sling. Using an elevation sling, you use a triangular bandage to prepare an elevation sling. And this is how it's done. Open the triangular bandage. You open the triangular bandage. You support the arm carefully as you reassure the casualty or take care of the casualty's needs. Also listen to what the casualty is telling you. Don't make it tight, just make it firm. Make sure you have stopped bleeding. Make sure that your casualty is comfortable. You support the sling. This is called an elevation sling. It supports the arm, the injured arm. You tuck that part in, ensure the thumb is out, so that you can keep on checking circulation using capillary refill. And now from there, you can take your casualty to the hospital. And what if you are stabbed or you suffer a gunshot wound and the knife is there, or the nail is there, or the bullet is there? What are you supposed to do? Do you pull it out? Join me next week for more information. Today, I'm here to learn together with you on how to manage an embedded object. This is a wound which has been caused by either a sharp object or any other protruding object, and that object have been left there. For example, a person have been stabbed, or maybe suffers an injury caused by a nail, or maybe it's also a gunshot wound and the bullet is there. How do you manage this? In most cases, people try to pull it out. You are not supposed to pull it, but support it and take the casualty to the hospital. Assuming my colleague have been stabbed and the knife is there. So the knife is there, you help the casualty by supporting the knife, and carry the casualty to support the knife, or you get even a bystander to come help in this. And then using a triangular bandage or a piece of clothing, you prepare a ring bandage or a donut. A ring bandage is prepared using any piece of clothing. You can use a triangular bandage or any other piece of clothing. You prepare a ring, a very simple ring, and this will help in supporting the object. So you pass it there carefully, and then you support. You apply pressure towards the object. All this time you keep reassuring the casualty, you keep comforting the casualty, and then thereafter, using more dressings and more bandages, you support it. So I'll come and prepare a narrow fold. This is a narrow fold, and using a narrow fold, you now support this object. So remember, do not pull it out. So you put the knot there. So how is it? Okay, it's better. Now you see we have stopped bleeding. Now to support it, I know you may not be comfortable, so I'll support the arm using this piece of clothing. So carefully support this arm. We prepare a simple elevation sling. Okay? After that, you take the casualty to the hospital. The casualty is now more comfortable after you have supported it with a simple sling. What if your casualty is having a scalp wound? This is a wound around the head. Join me next week as we discuss more on how to manage a scalp wound. Hello, and how are you? My name is Steve Mbugua. I'm a first aider, paramedic, and I'm a trainer with Makinika Afrika. And today I'm here to train you on how to manage a head injury. Head injury comes in a different format. We have scalp fracture, there is concussion, compression, and scalp wound. A concussion is shaking of the brain. Compression is pressure on the brain. Scalp fracture is a crack or break on the skull. And scalp wound is a wound around the head. A scalp wound can be caused either due to a scalp fracture, it can be due to a fall, or any other trauma incident can lead to a scalp wound. How will you know that a person is having a scalp wound? There may be severe bleeding, the person may look dazed. At some point you may find or see the person nose bleeding or having even blood coming out through the nose, and these are also signs of scalp fracture. How do we manage scalp wound? With the help of my colleague, I'll demonstrate to you how to attend to a casualty who is having a scalp fracture. Please have a seat. Now, assuming my colleague here is having a wound here, you have to be very careful, because if there is a wound around the head, also suspect a scalp fracture. So carefully make sure that your casualty is comfortable, you reassure your casualty, and using a soft padding or a wound dressing, you stop bleeding. And this is how you'll do it. Assuming the wound is here, you come, put the dressing around that place and keep on reassuring the casualty. You'll be okay. How are you feeling? What happened? You're fighting.
I just fell down.
Okay. Good, good. As I told you, I'll take care of you and take you to the hospital, and it shall be okay. How are you feeling? Do you have a headache? Okay. And can you see the person there? Okay. So you have a problem also with the side. Okay. So don't worry. I'm here for you. I'm here to help you and take you to and ensure that you've been taken to the hospital. So that's how you manage a scalp wound. Ensure that you make it firm but not tight. Make it firm to stop bleeding, but if it's tight, it may also affect bleeding around the head. After that, because the head, the casualty may feel uncomfortable, sometimes feeling like the head is heavy, you use a soft material like a cushion or a pillow to support the head. So you carefully support the casualty's head, call an ambulance, or take the casualty to the hospital. Always remember, all this time, reassure the casualty. Mind the casualty's need. If the casualty complains of anything, be there to attend to it. If the casualty complains of a headache, find out why the casualty is having a headache. Probably there is another severe injury. If a casualty is having a scalp wound and there is watery blood coming out through the nose or ears, suspect scalp fracture, and you have to be careful. Don't apply more pressure because you may be worsening the injury. What if at some point your casualty stops breathing? The casualty is not dead. As a first aider, you can resuscitate and save that life. Join me next week as we discuss about CPR. Thank you. Now, assuming you have a casualty who just collapsed and you don't know exactly what happened, check for danger around the casualty and find out whether the casualty is conscious or unconscious. And this is by checking the level of the response. You clap and call the name. Hello, hello boss, can you hear me? Hello, can you hear me? If the casualty is not responding, you pinch the ears and tap and shake the shoulders. If the casualty doesn't respond, you suspect that your casualty is unconscious. Open the airway, check for breathing, and checking for breathing, you look at the rising and falling of the chest, you listen, and you feel for warmth, for air coming out. If you suspect your casualty is not breathing, check for circulation. Lack of breathing, lack of circulation, as long as the casualty is, the body is not cold and not stiff, you proceed and you start CPR. Between the two nipples, at the center, that is the center of the chest, you place your heel and you interlock your fingers. Place your heel there, interlock your fingers, and you give 30 chest compressions. This is how you do it. Breathe in and you compress. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. As you do this, you interlock you lock your elbow and interlock your fingers. After giving the 30 chest compressions, give 2 rescue breaths or 2 artificial ventilation. And take care of yourself. Don't put your mouth directly on the casualty's mouth unless it's your wife, your husband, or your child. Always use personal protective equipment, more so CPR mask or face shield. And if you don't have this, you can use a piece of polythene paper and you drill a hole. This is how to use a face shield. You open it and you put this in the casualty's mouth and pinch the nose and you give 2 rescue breaths. So CPR involves 30 chest compressions and 2 rescue breaths. You proceed, continue with the procedure until the casualty recovers, or help comes, or you are too exhausted to continue. What if you are dealing with an infant. Your baby just stopped breathing due to choking, due to pneumonia, or any other condition. Join me next week as you discuss about this. CPR is cardiopulmonary resuscitation. Sometimes your infant may choke and stop breathing. Sometimes it may be due to near drowning. Sometimes due to pneumonia or any other condition affecting breathing. If your child is not breathing or stops breathing due to any of these issues, the first thing you do is you have to do very fast, because for infants, any respiratory condition sometimes may become fatal, so you have to move very fast. You check for breathing. Open the airway. Look, listen, and feel, and check for circulation. For an infant, you use either femoral pulse, which is in the inner upper thigh. You can also use brachial pulse, which is in the inner upper arm. But for adults, you either use carotid pulse, which is at the neck, if the casualty is unconscious, or you use the radial pulse if the casualty is conscious. The radial pulse is here at the wrist. So for our baby here, we will either use the brachial pulse or the femoral pulse. So our baby is not breathing and there is no evidence of pulse. So very fast, you start CPR. Now, this is my baby. Assuming you are taking care of your baby and you don't have a face shield with you there, you can't even proceed. Open the airway. You put your mouth directly on the baby's mouth, and you give 5 initial rescue breaths. You give the first one. 5 initial rescue breaths. Then 30 chest compressions using your 2 fingers. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. If the casualty or if your baby doesn't start breathing, you continue with the same procedure. Remember, the first case we say that you give 5 initial rescue breaths, 30 chest compressions. So after that, now you give sequence of 30 chest compressions to rescue breath, 30 chest compressions to rescue breath, until your baby recovers or you are too exhausted or help arrives. If your baby starts breathing, turn to recovery position. You can hold your baby in that manner and you reassure your baby. You can also hold your baby this way and you reassure him or her, but you must take that baby to the hospital immediately thereafter. What if your casualty just collapsed? The casualty just collapsed and became unconscious but is breathing. Join me next week as we discuss about recovery position. Jambo, my name is Steve Mbugua. I'm a paramedic and first aid trainer with Makinika Afrika, and today I'm here to train you on how to take care of a casualty who is unconscious but breathing. This can be caused by several factors. It can be due to fainting, it can be due to any other injury or condition. So you have your casualty who just collapsed and you don't know what happened, and you've tried everything but the casualty is not recovering. Before you call an ambulance, there is some few steps to follow, and so we'll see how to do a top-to-toe survey and turn a casualty to recovery position. So the first thing you do is, from a distance, you check for danger, you look around for any danger, ensure you are safe, the bystanders are safe, and your casualty is safe. Then you check for response. Hello? Hello? Can you hear me? Hello? Can you hear me? If you can hear me, open your eyes. Open your eyes. Hello? Hello? My casualty is unconscious. I'll check the priorities. Open the airway, carefully open the airway. Check for breathing and check for circulation using the carotid pulse. Now, my casualty is unconscious, but I found out that the casualty is breathing and there is circulation. So, what is the problem? I'll find out. From the head to the toe, you check for any deformity, any open wound, any tenderness, check for any swelling. Also, you check for any sign or symptom, as well as any medical clue. From the pocket, you may have a medical prescription card, or there may be a bracelet showing you that your casualty is having any medical condition, be it epilepsy, asthma, diabetes, and all that. They may have an evidence to show you this. So from the head, you check for any injury, check inside the ears, open the eyes, compare the size of the pupils, check inside the nose, open the mouth, you check for any object in the mouth or knocked out tooth or blood coming out, check the temperature, you can compare the casualty's temperature with your own. This is how you do it. Check the skin color. If the casualty is pale, you may suspect something. If the casualty is flushed, you may suspect something. You check the neck, check the collarbone, check the shoulders, check one arm at a time. You check even the joints, one arm at a time. You check for capillary refill, check whether blood is flowing. Check the other arm, check for capillary refill, and the bracelet which is here, you check what it is. It may be a medical clue, indicated maybe epileptic, diabetic, and all that. Then you check the sternum, check the ribs, check the abdomen for any deformity, any wound, any swelling. Check the lower part of the spine. You check whether there is any injury, any deformity, any wound. Check the pelvic, loosen the tight clothing. Check even in the pocket whether there is any object. You check the leg, still looking at the eyes, check whether you have blood. All this time be looking at the casualty's eyes, and also whether you have blood traces on your gloves. You check the kneecap, go down and remove the shoes. This is how you remove the shoes. Carefully and gently, you remove the shoe and you put it there. Then the leg again, still looking at the eyes for any response to pain. You remove the shoe carefully and gently. Then from there, you turn the casualty to recovery position. This is how you turn a casualty to recovery position. The arm which is next to you, you put it at 90 degrees. The one away from you, get hold of it and you put it there. Then the leg which is away from you, you fold it and get hold of the knee. No matter how heavy the casualty is, the casualty will just turn towards you. So get hold of the knee and turn the casualty towards you carefully. And then make sure the knee is well supported. You reopen the airway, you check for breathing, you check for circulation, and check for any injury at the back. That is a recovery position. So in case you have a casualty who is unconscious and breathing, turn to recovery position, call an ambulance, and you'll have saved that life.
When you ingest a poison, it brings about deterioration of the health. It may cause sickness, it may cause even death at extent consumptions. What happens when someone gets poisoning? The first thing you need to do is to observe the casualty. There may be symptoms about poisoning. The casualty may be pale, may be having a pale face, may be having blood constriction on the face, may be reddening the face. The casualty may also be sweating. So what happens when you get a casualty like that situation? You need to ascertain the situation and you need to ensure that you observe the situation. Maybe the casualty ingested something like an acid or a cleaning material or a food product. The casualty, one, what did you eat? Two, look for any signs of debris, signs of containers, signs of anything around, or signs of also vomit. You ensure that you have collected those things together. It will help the emergency responder to ascertain what kind of poisoning that the casualty has undergone. 2, you need to reassure the casualty that it is going to be fine. Most of the time you find that once someone has a poisoning issue, they freak out, and you find that they worsen the situation, because once you freak out, your heart starts beating and you increase blood flow, and so the poison will start circulating at a higher chances than when you are calm and when you are cool. 2, you need to ensure that the casualty is comfortable. Take the casualty, make the casualty sit comfortably, and introduce yourself to the casualty, ask for permission for the casualty to be helped, and also check for the temperature of the casualty, ensure that the casualty is not having a high fever. If he is having a fever, you address the fever. Also, the casualty may be in a situation whereby the poison is irritating the casualty. If the casualty swallowed an acid, for example, it may cause irritation of the food pipe. So what happens when you do that? You give the casualty small sips of cold water. This only happens when the casualty is having irritations. Do not give the casualty food, do not give the casualty anything to eat or to drink if it is not for that case of irritation. Because once you give the casualty something to eat, it may induce vomiting. When you induce vomiting, if the casualty had consumed an acid or something that irritates, it will have another effect of irritating once more once it is coming out. So we need to ensure that the casualty does not receive anything to eat or to drink. Third, if the casualty is not the casualty you have observed, if the casualty is not responding, ensure that you call an ambulance. Once you have called the ambulance, continue to assure the casualty, make sure that the casualty is comfortable, and also make sure that you keep records of what you found around the scene so that you can address the situations once the EMS arrives. 2, there is something called food allergies. What happens in food allergies? Food allergies causes allergic reactions to the body. This is a reaction whereby the body has hypersensitivity to the foreign matter that has been introduced into the body. Once you have a hypersensitivity, it may be a minor hypersensitivity or it may be an advanced hypersensitivity. On the cases of hypersensitivity of low measures, you need to check what the casualty has consumed. It may be shellfish, it may be peanuts, it may be any type of food that the casualty has taken. Most of it happens when the casualty is not aware. Maybe you have bought a piece of bread or a piece of cake, and the cake had nuts or such things, and the casualty has consumed. There are symptoms which the casualty will show. 1, the casualty may start having swelling around several parts of the body. The casualty may start having small swellings coming out of the skin. The casualty may also start having sweating and reddening and becoming pale. When this happens, the first thing you need to do is assure the casualty that it's going to be fine. The second thing you need to do is ask the casualty, do you have any kind of allergic reaction? Is any food allergic to you? Ask what they ate last. Ask if the food, they bought it or they had made it themselves. Once you have done this, ask the casualty if they have medicine to take care of that situation. There are 2 things that you have. 1, there is the epinephrine. Epinephrine is a medicine that is administered to casualties who have allergic reactions. Let me show you what they look like. This is called an EpiPen. It is an epinephrine pen that is administered to adult. This one also is administered to adult, but there are also those that come for small children. Once you have this, help the casualty to administer the EpiPen to themselves. What happens is that when you administer the EpiPen, it helps to lower down the hypersensitivity and to regain control of the nervous system of the body. When you want to administer an EpiPen, you ensure that there is close contact of the EpiPen to the body. Once it is in close contact, you just press the EpiPen. It discharges that dose of epinephrine. 2, children sometimes you find that they will be afraid, they will start feeling afraid. There is an EpiPen that is bought for children that has a lot of encouragement. It has good tunes, good music. And when the child has that situation, once it starts administering, it will tell you open, administer, and then massage after administering. Today we are going to discuss about fevers. First of all, what is a fever? A fever is a body reaction that happens when the body detects foreign matter in its system. When you have a fever, the body elevates its core temperature in order to try and destroy whatsoever pathogens or viruses that have invaded the body. Once you observe that one person has a fever, what happens is that there are symptoms to fevers. 1, the person may be sweating. 2, the person may be feeling cold or shivering. And 3, the person may be having a pale face. What happens when you have a casualty that is having a fever? The first thing you need to do is that you need to ensure that the casualty is having light clothes on them. Try to reduce the heat of the body. Remove any heavy clothing that the person has. If they are in the casualty is in bed, remove the casualty, the blankets or the coverings. Ensure that the casualty has minimal dressing. The second thing you need to do once you have a casualty is to ensure that the casualty is reassured. Once the casualty has been rid of excess clothes and the casualty has been reassured, let the casualty calm. If the casualty has these occurrences of fevers, ask the casualty if they have any medication in them. Most of it you see that they administer paracetamol. This is administered to children up to the age of 16 years. For adults, you can administer aspirin before calling for aid so that you can let the situation be handled by an emergency responder. For more information about seizures and epilepsy, let us join next week and have a good time. Today we are going to discuss about seizures and epilepsy. What is a seizure? A seizure happens when the brain has a concussion. Maybe the brain, maybe you have been hit, or maybe you have fallen down, or maybe you have a genetic inheritance of seizures. So the person will exhibit several symptoms. 1, the person, if you are in discussion or if you are having a conversation with the person will disconnect. The person will start looking around. The person will look as if they are not feeling well. The person may start staggering around. What happens when you observe this situation? So the casualty has started experiencing convulsions. The first thing you do is to hold the casualty. Ensure that the casualty does not get injured. If you have a sweater or a jacket or something, make it so that the casualty becomes comfortable and let the casualty lay down. The next thing, so the casualty is comfortable. If the casualty has a lot of convulsions, you hold the casualty down. Don't put anything in the casualty's mouth. Let the casualty rest. Ensure that there is space for the casualty to breathe and observe as the casualty regains consciousness. Once the casualty starts regaining consciousness, you can check for responses. So, are you fine? Anywhere you are feeling anything, pain or anything? Okay, what happened? Do you have a case of epilepsy or something?
No.
You don't have a case of epilepsy?
No.
You have never had a case like that one?
Yeah.
So if the casualty has never had a case of epilepsy, you can contact the emergency respondents so they can come and the casualty may be taken to hospital to go and check what happened, because maybe it is a new occasion. But if the casualty usually has epilepsy, you can ask the casualty, what happened? Have you eaten? When was the last time you ate? Yesterday.
Yes.
Epilepsy maybe can be triggered by hunger. So what happens is that the first thing, if you are in a crowd or something, you don't start asking people to contribute money to get the casualty something. You take the initiative, get into your pocket, get out some cash and say, hey guys, let us get some cash here. We can offer a guy some food so that maybe that is how you help. That is how also you help the casualty. Once the casualty has gained consciousness, you can tell the casualty to sit. Just help. Don't make him don't force him to sit down. Just ensure that he has sat down well, and then if he has, you ensure, maybe, do you have medicine? Did you carry your medicine?
No.
Maybe they have forgotten to take their medicine. So you can also try and give the casualty something to eat to energize the body. And once he's done that, you can now help the casualty to wake up. You can take the casualty to the nearest hospital. Maybe ensure that the casualty has been educated not to leave their medicine, and also to ensure that they take something, even if it is a little bit, before they get out of their house where there is no one around.
Assuming my colleague suffered a fracture and there's a broken bone around this point, some of the recognition features, there may be pain, swelling, there may be tenderness, and inability to move this limb. These are the lower limb, if it's the arm which is injured. The management of fractures, you assess for danger and reassure your casualty. Be careful to minimize movements. You support the injured arm as you reassure. Kindly support yourself. Using a crepe bandage, use a crepe bandage to support and steady the injury. So you use the crepe bandage, you carefully support the fracture. Make it firm but not tight. Firm in a way that it minimizes movements of the broken bones. But if it's firm, if it's very tight, it may also cause more injuries. It may also even affect bleeding. So after putting the crepe bandage, you use a triangular bandage to prepare an arm sling. Using a triangular bandage, you need to support this arm so that you can take the casualty to the hospital. So you just support yourself. This is a triangular bandage. It's very good to help you come up or prepare an arm sling. You put a knot at the back, a leaf knot, which is very simple to undo. Ensure the arm is well supported. Then you put a knot here, and there you have an arm sling. With this, you can comfortably take the casualty to the hospital, or you call an ambulance.